coming in. All right. Hello, everyone. Welcome. Seeing lots of people coming in. We'll be getting started in just a few moments. All right. Hey, good afternoon, everyone. Let's just get started now. So welcome to our webinar today on April 4th, 2024. My name's Amanda Delory. I'm the Member Programs Coordinator at Digital Health Canada, and I'll be your host today. I would like to begin by acknowledging the Indigenous peoples of all the lands that we are on today. While we meet today on a virtual platform, I would like to take a moment to acknowledge the importance of the lands which we each call home. So please go ahead and share in the chat the territory that you are joining us from today. All right, let's get into it. So today's webinar is From Learning to Leading, Career Building Tips from Emerging Digital Health Professionals. So it is my pleasure to introduce our panel. We have Hrudaya Wunudurthy, a business analyst at Provincial Health Services Authority, Stephanie Rintoul, a clinical innovation coordinator at Hamilton Health Sciences, and Francesca D'Angelo, clinical innovation coordinator at Hamilton Health Sciences. So I'm very excited to have this group of emerging professionals today. And so I want to encourage everyone to please send any questions you have to the Q&A tab at any point during the presentation, and we'll be sure to get to them at the very end. And so first, I will now pass the mic over to you, Stephanie.
Thanks, Amanda. So a memory ingrained in my mind is second year university undergrad. I'm in my biomedical sciences at the University of Guelph, and I have to make a decision about what I'm going to do next. What is my next career move? And all throughout my undergrad, I was being asked questions such as, do you want to go to medical school? Do you want to be a doctor? And if you know the University of Guelph, do you want to be a vet? But I really needed to block out that external noise and figure out, okay, what are the other opportunities that are available to me? So what I did is I just opened up my computer, went to Google, looked at the different universities, and I just went through the university programs one by one, seeing if there's something that jumped out to me that caught my eye. And what I did come across is health informatics. Now, at that time, I didn't know what health informatics was. But what I did know is that I could leverage my science background towards this type of program. So I did a little bit more research. I came across health informatics, digital health, e-health. And what I did find is, in simple terms, it really was an intersection of science, business, and technology. And, science, I was like, check, okay, I have that from my undergrad degree. Business, I know my parents always told me that business is always something that is good to have and always something that you'll be able to find a job in. So that was a plus. And then technology, I knew that that was the future and that technology would be something that could make a powerful impact. And so I wanted to pursue applying to different universities with these programs. And what I eventually landed in is e-health program at McMaster University. And what really sold me on this program was the 8-month internship portion. Because as we know, it's really difficult nowadays to really land a job, but if you have work experience, especially getting that work experience in your master's degree, is something that will set you apart from the rest of the people who are applying. And so now that I was in my Master's of Science and I knew that there's an internship component, I was thinking about, okay, when it comes time to apply for those internship placements, I need to find a way to differentiate myself from everyone else in my class. And so I was looking for things like certificates, and I knew I was interested in projects, and that's where the Project Management Institute came in. I had heard of the PMP, the Project Management Professional, but you need sort of work experience in order to get that certificate. So what I did find was the Certified Associate in Project Management, or CAPM for short, which all you need really is to take a course in project management and then go ahead and take the exam. And so that's exactly what I did. I went through those steps and I was able to get that background knowledge of project management to then be able to, once I applied for those internship positions, say that this is something that I'm interested in. I'm interested in the space of project management. I've gone ahead and done my CAPM and I'm now working towards my PMP. And I did get feedback from employers that that was something that really made me stand out and gave me more opportunities. So I encourage you, when you're going along in your career journey, to look for different things that will make you stand out, whether that's certificates, a course you took, you attended a conference, any program, just something that shows that you're interested in something and you're able to take steps towards sort of building your knowledge base, building your skills in that area. So now looking at the internship component and my work experience, and how do you really navigate going from, that education, that style of learning where you're studying and you're really looking to, get an A+ on that paper or get that 80%. And then now you're in the working world. It doesn't quite work the same way, right? You might get positive feedback on a project you're working on, but you won't really get that direct, that instant feedback on the tasks that you're doing. You really are waiting for that bigger impact of your project work, and that's what's really rewarding in the work that you're doing. So I started my digital health intern position at Hamilton Health Sciences. And what I did at the start of my internship, which was actually part of the health program, but even if it's not, I encourage you to do this if it's not part of your program, set learning objectives for yourself, or you can call it career goals. Just what do you want to achieve out of this experience? And for me, I was really looking to gain hands-on project management experience. I wanted to build my data analysis skills. And I really also wanted to build my network within Hamilton Health Sciences, but also externally in the broader digital health community. And one project that I'll speak to that really brought all these skills together for me was the VOICE project. That's VOICE. And if you're not familiar with this, VOICE is a technological solution that provides on-demand language translation services that facilitates communications between patients and providers. And it does so by a provider being able to select the patient's preferred language on an application. And then that interpreter will come on live, basically like a video call, or it could be an audio call, and translate that conversation. So this project was really my first exposure to seeing how technology can have such a large impact on addressing barriers to patients accessing care, and in turn, empowering patients to play an active role in their own healthcare. And that's really where we see healthcare going now, is having patients be more involved and having that two-way communication between patients and providers. So now I want to switch gears and talk about Digital Health Canada, but also talk about taking advantage of opportunities generally. And I'll be frank, when I first had my Digital Health Canada membership, this was back when I was doing my Master's of Science, I did not take full advantage of all the opportunities. And now that I am taking advantage of them, I can really see the difference. So one opportunity that I encourage you to take advantage of is the Webinar Wednesdays, and it's great that you're all attending this webinar today. And I really encourage you to do so, because you never know when you may gain a little tidbit of information in that webinar that may connect with something you're doing at work, connect with something that you've learned, or even just spark an interest in something further that you may want to go in and do some more research on, or just change and pivot in your career. The next one I want to speak to is Up on Digital, which is a one-day conference that I attended for the first time this year. And in short, it's really an update on all things going on in healthcare in Ontario. And it's a perfect snapshot to see how what you're doing really applies and is brings things into a broader context. And then next slide, please, Amanda. So here I am presenting at last year's eHealth conference. And I had the amazing opportunity, and I presented on the VOICE project. So I really had the opportunity to talk about the success that the project team had in implementing the VOICE solution, and really being able to see the impact and the positive effect it had on patients as well as provider experience. So whether it's Digital Health Canada or other networks that you really connect with. So for me, it's also Project Management Institute. And recently I attended the PM Expo, which was a virtual conference that had all these different sessions that you could hear about sort of the challenges in project management. And one session I really connected with it was called Tracking Your Career Journey from the Perspective of Project Management. And what that really means was looking at your career journey and making a plan for yourself, making a roadmap in terms of, okay, there's a certificate that I want to start this year and I want to obtain it by next year. And then how does that apply to your broader plan of where you see yourself in 5, 10, 15 years in your career? So always sort of planning on doing things that make sense in terms of where you want to go. But having said that, in terms of, making those what feel like major decisions, such as what I was talking about at the beginning in your undergrad degree and you're deciding what you're doing next, don't feel like that decision is locking you into anything. That is just one step in your career, and you can always sort of shift gears, you can always move on to something else, but you're still gaining something out of that experience. And so just to end it off, please seek opportunities for growth. And with that, I'll be going to the eHealth conference this year in Vancouver. So if anyone's going, I hope to see you there. And please feel free to connect with me on LinkedIn. And I look forward to answering any questions at the end of the session. Thanks so much. I'll pass it over to Hrudaya.
Hello. Hi, everyone. So my name is Hrudaya Wunudurthy, and I'm currently serving as a business analyst at Provincial Health Services Authority. And first of all, it's truly an honor to be a part of this webinar and share my journey as an emerging professional in the realm of digital health. And to start with, my path in healthcare began with my bachelor's degree in health information sciences from India. And to be very honest, at that time, the field did not garner much interest. And I'm talking about somewhere around 2012 or 2013. And I absolutely faced some skepticism about its prospects. More than it was for me, I think it was more around the people that were around me who were like, oh, no, this couldn't be the right option. Actually, there's no much job opportunities out there. But I still went. Despite of all that, I found immense fulfillment in my studies and cherished every moment of my college experience. Had great opportunities doing research papers and great exposure to different leaders out there that when I was in college. So after graduation, I definitely encountered some challenges in finding some career opportunities to apply my knowledge practically. But I didn't give up to expand my expertise. I just pursued some certifications in Scrum Fundamentals, SDLC, which is Software Development Lifecycle, because I was very much into the project management side of this stuff. And I did certification to complete my business analysis. So which eventually led me a role in healthcare ID project management. And absolutely through networking and through building my connections, I transitioned to point-click care in Canada, where I deepened and I moved and relocated to Canada, which was a great opportunity for me, where I deepened my understanding of technology's role in the healthcare in the healthcare environment. And to be very honest, I think COVID-19 has undoubtedly accelerated the digitalization of healthcare system worldwide. It was definitely we have been running towards technology since forever, but the minute COVID-19 hit, I think everything went on. Like there was no chances we could sit on paper, and it was and somehow I had an idea to do my master's as well, but how it planned out that I ended up doing my master's during the same time, where I think it was more around the time that I didn't have to take off from work. I was working at the same time and I was doing my master's because I had an option to do it virtually. So I completed my master's in global healthcare administration from a US-based university, New Jersey, called Fairleigh Dickinson University. And since the coincidence was that everything was a virtual shift, I had an experience of work and studying at the same time, which I definitely cherish. And this experience provided me with valuable insights in how the North American healthcare landscape works. And to be very honest, my passion for leveraging the technology to enhance healthcare outcomes has been the driving force behind my career and my career building especially. And after completing my master's, I was looking for some change, and I started exploring my options to move my career forward. And I landed up a job at Provincial Health Services Authority as a business analyst, and where I have witnessed firsthand the transformative power of technology in healthcare. I have been fortunate enough to be a part of an extremely aggressive, huge, and a multi-year project of clinical systems transformation, which aims to improve the safety, quality, and consistency of patient care across the three British Columbia healthcare organizations, which is Vancouver Coastal Health, Providence Health, and Provincial Health Services Authority. So this project basically supports the health organizations in establishing a common clinical and process standards, which includes workflows, audit sets, clinical guidelines, integrated plans for care, and common electronic health records, which is a major challenge when you are in paper. So this transformation is being supported by implementation of a common clinical information system, which is called CST Cerner. Cerner is what the application is, which basically is replacing all the multiple existing systems or any that has been all the paper systems as well. If you are on paper records, everything is getting transformed into the Cerner system, which is the electronic health record system. And this is prompting a shift from all that age-old paper and paper system to the electronic e-records. And I'm really fortunate to be a part of this work. We're at a point that most of them are using CST Cerner right now within these three health organizations, and we are at a point that we are completing all the go lives. And as being a part of Provincial Health Services, I have had the best opportunity to work under the leadership of Shannon Melwock. And not so long ago, my Executive Director, Shada Reid, presented me with an opportunity to volunteer for Digital Health Canada, which of course I eagerly accepted it. I did come across Digital Health Canada before while I was working at Point Click Care as well, but at that time I did not have the opportunity to be a member. But now, as I am, I'm feeling really glad because I see the Digital Health Canada as a forefront of the digital health revolution, where it's serving as a hub for innovation, for connecting people, collaboration, and provincial advancement. And I believe becoming a member provides you access to the vast network of industry leaders, resources, and events that are tailored to fuel the professional growth. And, however, I don't see that just membership is just the beginning. It's just the start. Once you start volunteering with the Digital Health Canada, it offers you invaluable hands-on experience and exposure to real-world challenges and solutions. Whether contributing to special interest groups or participating in committees or assisting with events, volunteering expands one's skill set, and it'll definitely help you build meaningful connection and make a tangible impact on the digital health landscape. And as I think Stephanie mentioned, the Wednesday webinars, they are amazing. They are absolutely amazing. I think one recent example that comes into my mind is I attended a Wednesday webinar on how generative AI addresses healthcare challenges. I think it was early first week of Feb that I attended this webinar. And coming out of that, it talks about how healthcare organizations around the world are leveraging generative AI and other AI platforms today to help better patient outcomes and improve the quality of life for clinicians. And such a coincidence that I came out of that webinar and a few weeks later, I had a chat with my manager, and he was telling that, okay, our scope has been expanding our project, and now we are looking for exploring some option around the AI platforms that we can leverage. And that webinar actually helped me, and it equipped me with giving some and providing some insights relevant to my current project. So I feel that it has got so much resources. It's such a huge community that help you. You can use that knowledge that is coming out of those Wednesday webinars to actually put into your regular work directly and link them. It is going to help you build your career like that, likewise. And while I feel I got a bit late joining this vast community, but you know what they say, it's better late than never, right? So I'm glad to be a part of this community of Digital Health Canada, and I look forward to all further opportunities, or whether it is volunteering or participating in any conferences or webinars, I'm just looking forward to all those. And as coming out of my experience, if I have to give my 2 cents through my experience for over 6 years, I would say take these 5 things when you are taking away from this presentation is that embrace lifelong learning. I believe that digital health field is constantly evolving, and it is very important to stay abreast of the latest trends, the technologies, and best practices. It's very crucial, whether through formal education or certifications or self-directed learning. I would say make this as a continuous priority, no matter at what stage of your life you are. Even if you are at the if you end up at the executive level, that I have reached my heights, I would say no. Always make continuous learning your priority, because with technology everything is evolving, and there's always need to adapt to those changes. And the second would be seek mentorship. Surround yourself with mentors and peers who can, offer you that guidance, the support and insights gleaned from their own experiences. And I think you've started that by joining this webinar itself, is that any opportunity you get to connect with people who can teach you with their own experiences, it can provide you invaluable advice, encouragement, and sounding board for ideas and aspirations. And the third one would be the network strategically. This platform could provide you that by attending industry events, conferences, webinars, like today's session, where you can connect with like-minded individuals and industry experts and cultivate meaningful relationships. And I would say don't be afraid. Don't hesitate to reach out and engage with professionals whose work inspires you. So always feel like people say, just if you have a way to reach out to them, just go. Do not hesitate. Ask questions. Learn from their experiences. And the fourth one is gain hands-on experience. That is what is important. Landing job these days has been so difficult that I would say any chance you get for an internship opportunities, putting volunteering stuff or research projects, or anything, any kind of exposure you get, which I believe there is a lot out there through the digital health, just take them, because it only enhances your skills. It just not enhances your skills, but it will also boost your resume when you put those credibilities on your resume as a digital health professional. And last but not the least, stay agile and stay adaptive. The digital health landscape, as I mentioned, is characterized by rapid change and innovation. Be prepared to adapt to these new technologies, methodologies, and the paradigms as they emerge, and embrace a mindset of agility and resilience. It is, and I see that digital health on a one side, on a one hub, is giving you all these 5 opportunities on hand, and utilize those resources, and it'll help you build your career out. And in conclusion, I just want to say that embarking as a career in digital health is an exciting and rewarding journey filled with opportunities for growth, innovation, and impact. By becoming a member and volunteering with Digital Health Canada, I believe you can unlock a world of possibilities and take meaningful steps towards realizing your aspirations in digital health domain. There's so much out there. There are so many different technologies out there. So I would say take your time, go through all the resources that you have, check out through the courses that interest you more, whether it is data, or whether it is, as I mentioned, generative AI, which a platform interests you most, or it could be project management side of the stuff. But anything, explore, get inspired, understand your aspirations. What is your interest towards which part of the health domain is what you are more lean to? And I encourage each and every one of you to seize that opportunity before you leverage the resources and support available to the Digital Health Canada, and actively pursue your passion for transforming health care through technology. And at the last, I would like to say that it has been a great honor to speak to you all. And I'm looking forward to any questions that I have from you guys, and happy to answer them. Thank you so much. And I'll pass the mic over to you, Francesca.
Thank you very much, Hrudaya. Hi, everyone. My name is Francesca D'Angelo, and I'm a Clinical Innovation Coordinator at Hamilton Health Sciences. I would like to begin by thanking Digital Health Canada for inviting me and the other panelists here today to talk a little bit about our professional development. So I would like to begin by shifting your attention to the map that you can see on the left side of the slide. And the reason why I put this map here with the pin in it is because this is my personal journey. And I think that this very much affected and influenced my professional development. So quickly to go over it, I was born and raised in Argentina in a city called Mendoza. Me and my family then moved down to Patagonia in a small town where we lived for about 8 years. And then we moved back up to a different province called San Juan in the north of Argentina. This completed my primary education. And then we moved to Brazil, Sao Paulo, where I started my secondary education. And during my years up until then, I had been learning English as my second language. And I decided that I was going to do a language exchange in Oxford. So I spent a little bit of time in Oxford and then returned back to Brazil. And then my family moved to Canada in 2014. And ever since then, we've been living in Canada, with the exception of in 2022 that I moved to Barcelona to pursue my master's degree, which I will be speaking a little bit more in a few seconds. So now to dive a little bit deeper into the specifics of my professional development, I'm going to touch on 4 different points: my education, my employment, my volunteering opportunities, and also my certifications. So for my education, I obtained my Bachelor's of Science in Life Sciences from the university, from McMaster University. And then, as I mentioned, I went on to Barcelona to complete my Master's in Creation and Management of Innovative Companies from the University of Barcelona. And the reason why I decided to go to Barcelona, I will touch on the next point when I talk about my employment. So my first experience in the healthcare field was actually working for Orange, which is a paramedics company here in Ontario. And this gave me that first initial step into the healthcare industry. When I completed my my degree at the McMaster University, I started working as a research assistant in the Department of Medicine under the supervision of a cardiologist, in which I helped her with a few research projects that had to do with digital healthcare. Specifically, she was looking at remote patient monitoring for heart failure patients. And that's when I felt the passion. And this is when I started realizing that digital healthcare seemed to be the field that I was very interested in. Because up until here, I would say that a life sciences degree is very broad. So, which is very nice on one side because it gives you a lot of opportunities to explore a lot of different fields within science, but at the same time, it's quite broad. So it's a little bit difficult to then decide to specialize in something. So this employment opportunity, I would say, was the one that was my first indicator that I would like to pursue something that had to do more with digital healthcare. And this, I knew that I wanted to do my master's degree afterwards, and I had been wanting to study abroad. But because of COVID, I didn't get an opportunity to do my exchange that I had in my plans. So I said, why not do my master's abroad? So then I went to Barcelona and I completed the master's that I talked about. And the reason why I chose that master's is because they didn't have a specific master's in e-health or specifically digital healthcare, but they did have a master's that was a very broad overlook at innovation. And so it's something that was very new to me because when you're doing your undergraduate degree, you are so focused on science that there are all these different things such as innovation that they don't come to mind when you think of maybe an opportunity to get a job in that field. So I definitely think that my master's degree really gave me that perspective. And during my time in Barcelona, I got a chance to also go to a lot of conferences that were focused on innovation. And I think that, again, further opened my eyes into all the opportunities that are in the digital healthcare field, because I learned how all these different companies were innovating and had all these innovation departments in which there were a lot of very interesting opportunities. So then when I returned back to Canada last year in September, I had a little bit of a clearer perspective onto what I wanted to work on. And this was because during my time at the University of Barcelona, I also decided to take advantage of my time there, and I was able to work for them. So I worked as a project coordinator in an organ donation transplantation initiative. So because I was in Spain, that's when I found out that Spain actually has the highest rate of organ donation transplantation. And there's a lot of countries within Europe that have very low rates. So the aim of this project was to educate other countries with all the innovative technologies and solutions and practices that they were implementing in Spain, so they could also do something similar in their countries and get higher success rates. And this opportunity really gave me a great overview into what it would look like to work in the project coordination or project management side of things. And this was also combined with what I was learning at that time during my master's degree, which was my first introduction to project management. Finally, when I came back, I kind of had a clearer understanding of what I wanted to do. And that's how I came across my current role that I'm at, which is Clinical Innovation Coordinator at Hamilton Health Sciences. And in this role, so far for me, it's been extremely fulfilling and rewarding, because what we get to do is implement different technologies that are innovative within our healthcare system and see if they actually can drive solutions to some problems that we're currently experiencing. And to me, that is extremely fulfilling, and it really matches what I learned in my undergraduate degree combined with what I then learned in my master's degree. So now to jump into my volunteering and then my certification. As Hrudaya and Stephanie already mentioned, Digital Health Canada has so many different great opportunities to get involved and to learn more about the digital healthcare world and field and what's out there. So for example, the webinar Wednesdays, as they mentioned, they're excellent, as well as today's webinar, I guess. And also, they have a lot of different events that are very interesting and that you can get a chance to volunteer, to meet a lot of leaders in the industry, to hear a little bit about the trends and the new topics. So any sort of volunteering opportunity with Digital Health Canada is definitely a step in the right direction if you're planning on pursuing a career in the healthcare field. And then also another volunteering opportunity that I think was pivotal for my career development was I got a chance to volunteer also as a research assistant at McMaster University, but this time in the Department of Psychology, Neuroscience, and Behavior. And what was great about this opportunity was that the way that I was able to get a hold of this opportunity was because I was curious after a presentation from one of my professors at McMaster. My professor had a great development. She also was from Brazil and then pursued her master's in the US and then was now working at McMaster University. And she was young and had an incredible amount of publications and an incredible amount of achievements and awards that she had won. So I became curious and I asked, what steps did you take to get to where you are? Because that very much seems like something I want to do. And that's when she offered me the opportunity to volunteer. But also she offered me something that was very important, which was guidance towards my next steps and towards what I can do with my career. So I think these things are always important because they open so many doors that are later helpful for your next steps. And then finally, just to mention a few certifications. Recently, I obtained the certification that is Generative AI Overview for Project Managers. And this is done by the Project Management Institute, PMI. And also early in my career, when I started working in research, I also obtained my Good Clinical Practice certification. I got it from City Program, but I believe there are a few other organizations that are certified with that you can get your certification. And this is a great certification to have because any kind of role that you will have in healthcare, it shows that you are aware and that you understand what are the good clinical practices within healthcare. And finally, the last two that appear the logos in the slide are the PMP and also the CP-HIM certification. So the CP-HIM certification and the PMP, both of them require for you to have a certain amount of years of experience on the field to then be able to apply and write the test and obtain the certification. So I put them up here because these are two certifications I'm working towards. And the PMP is great if you're thinking of pursuing any career that has to do with project management. And just as Stephanie mentioned, I also had heard from a lot of different industry leaders that it's very good to have the certification if you're planning on pursuing that career path. So if we can please move on to the next slide now. So and also this is something that the past panelists have also mentioned a few of these points, but I just wanted to sum everything up in a few takeaway points. So the first one I want to mention is to not be afraid of take those risks and to be curious and take those risks, because when you take those risks, you will encounter challenges, but you can embrace those challenges as opportunities for growth. For example, for me, it was a risk to go to abroad to do my master's because I wasn't sure if when I returned to Canada, I would be able to find a job as easily as if I had done my master's here in Canada. And of course, moving to Spain by myself was a huge challenge, but the amount of growth that I observed for myself in that experience was tremendous. So I definitely recommend that not to be afraid of taking those risks. Second thing I want to mention is to continue learning. And I think this is very important. Even if you already pursued your undergraduate or your master's or your PhD, there's always room for continuous improvement, continuous learning, and continuous adaptation. So to stay updated with the latest trends, to acquire new skills, and to be very open-minded. So for example, for me, having obtained that certification, generative AI, was a way of staying up to date with the latest trends within the industry, and then how to apply that into project coordination or project management. The third thing I want to mention is networking. And I know we hear about this a lot. Everyone mentions it a lot, but I really cannot stress the importance of networking. And this doesn't have to be, high level, and you don't have to make it such a huge deal. It can be something simple as attending at conferences, introducing yourself, and learning a little bit about the other person, as well as learning and telling them a little bit about yourself. Or for example, when you go to conferences and there's different companies that they're showcasing their latest products or innovations, it's great to talk to them and learn a little bit about what those companies are getting themselves, what are the products that they're developing, and what are the latest trends. The fourth thing I want to mention, and something that also Hrudaya mentioned recently, was to seek mentors and seek mentorship. And again, this can be a professor of yours. In my case, for example, it can be your manager, it can be your mom, your dad. There are so many people out there that have had already so many years of experience that they can give you a lot of valuable insights, advice, and support. And this can really help you guide yourself towards where you might want to head in your career. The fifth thing I want to mention is to set clear goals. This is also something that Stephanie had mentioned recently. And sometimes it's a little bit difficult to set clear goals when your career path is not so clear for you. And I think this was something for me when I had just graduated from my undergraduate degree. But even if it's just those small steps, even if it's, my goal is to obtain the certification, my goal is to attend this event, my goal is to publish a research project, whatever it is, just setting those goals is very important because it provides you guidance towards where you want to go. And as you achieve those goals, usually more goals open up and there's more opportunities. For me, for example, my next step for goals of what I just talked about were those two certifications that I'm working towards. And last but not least is to stay engaged in your industry and actively participate in events and communities. And again, Digital Health Canada is great for this because they offer so many different opportunities in which you can volunteer, conferences that you can attend, webinars that you can listen to. And in this way, you can stay very active within your industry. And also you can learn a lot, and it can open a lot of doors and open a lot of perspectives. So for example, for me, having gone to those conferences really opened up my mind about all the different opportunities that are out there that previously I had no idea they were out there. simply because I hadn't exposed myself to those opportunities. So with this, I hope that these tips are helpful for your career development. And I thank you very much for listening to my career journey. And now I'll hand it back to Amanda for the Q&A session.
All right, thanks so much. I just stopped sharing my screen just to make it a little easier to see the Q&A. All right, everyone, please make sure to submit your questions to the Q&A tab. We have one all ready to go, but if anyone has more questions, definitely submit them. All right, so we have one specifically for Hrudaya. So they're asking, could you please share a bit about the change management components in your clinical transformation project? Specifically, how to design the training programs most effective for staff and clinicians to adapt to changes?
Of
Very
course,
good question.
that's a great question. And it has been a greatest challenge of the project, I would say. I always call myself, even in my front of managers and everything, I'm a baby to this project because I think this has been happening since 2013 or 14 that it was initiated. And I think there has been a lot of work put on. I think a straight 5 years of work, and the first live happened in 2018. So it's not a small task, especially to something which is handling such a big aspect. It's just not one clinic. It's just not one hospital. It is including everything across VCH, Providence Health, and Provincial Health Services Authority. So it's covering half of the Lower Mainland, or I said more than half of the Lower Mainland. And as part of that, definitely there has been a lot of governance structure that was put forward. And as part of that, we have a team which is called the Provider Engagement and Adoption, which basically engages all the providers, or if you say clinicians and staff out there, who specifically tailors all the documentations and communications and support that needs to be provided as part of this change. Now, as you can see, the change is not simple. You are basically transferring all your current system, all your current data into an entirely new system. And everything is electronic, everything is technology. You might feel a lot of resistance, but I would say a lot of effort has been put around that. More than a change more than documenting that change, I think the team has provided them live support when each and every clinic or hospital went live. And to that, what I mean is that a straight 1.5 months support happens during and after hours, where the team members stay there and guide them through the change and through the process. So I would say to tackle something this huge, where there's such a shift in the change of how you work, more than designing on what kind of document should go. Basically, there were tons of SOPs that were put forward with each and every step that they had to follow while admitting a patient, putting orders, making any medication orders, and anything that sort. But I think more impact happened when there was go live support that they provided. There were literally, I would say 10, 20, 30, based on the amount or based on the size of the clinic or the hospital. We had all the people supporting these clinicians and staffs and nurses everywhere around, even during the hours and after hours. And that's how it has come forward that we are at a point that we have almost covered a lot of the clinics and sites, and hoping to end this by this year. Yeah, but yes, that's definitely a challenge, a task. But I would say for any change management, it is important that you clarify what your current state is, what is changing, and how you support through this change is very important.
Great, thank you so much. All right, we have a few more questions. One is specifically for Francesca. They're asking about, can you share more about the generative AI course and clinical practices course that you mentioned? Which one is it?
Yeah, absolutely. So it's called Generative AI Overview for Project Managers. It is by PMI, that's the Project Management Institute. And essentially, it's just as the title says, is an overview of generative AI and how to implement that within project management. I thought it was a great course, especially because I didn't think I was very knowledgeable previously with AI, and AI is such a hot topic right now. And slowly but surely, I definitely see that AI is being integrated into our everyday, regardless of what industry you work in, but specifically in healthcare. I'm very excited to see how it's being integrated recently, and I think it will continue to be integrated. And in that, oh, thank you. I don't know who shared. Thank you, Nikisha.
Yeah,
She shared
thanks,
the link
Nikisha.
on the chat. But in the course, essentially, they just give a brief introduction into artificial intelligence and generative AI. And then they explain how you can apply and leverage those tools into project management. So I thought it was an excellent course to learn, and it wasn't very long, so I definitely recommend it if you're thinking of pursuing digital healthcare or want to learn a little bit more about generative AI or even that apply to project management.
Great. Thank you so much, Francesca. Okay, this next question is for all the speakers, and the question is, would you say having obtained your master's degree gave you an edge in the digital health field, and do you think it's a necessity? Not sure who wants to answer first.
I can speak to that first. So I would say having your master's degree does help in terms of not even just digital health, but just generally, I would say for applying to jobs, but also in terms of the skills you learn in your master's degree. I find that there was a lot more group work, a lot more presentations, a lot more along those lines that I think are really applicable in terms of once you transition into the workforce and you're able to apply those skills. I think for me, as I mentioned previously, having the internship component is something you should look for if you're considering a master's degree. I know that there's also like MBA programs that have internship portions, so you can always consider that. But I would definitely look for one that sort of has what you want to get out of your master's. So if that's the internship, if it's that you want to develop more skills in a certain area where you feel like you are lacking currently, I would say to go for it. But that would be my thoughts on that.
Actually, I just wanted to add, that's totally, I agree with what Stephanie said. I didn't see it as a necessity, but at the end, with the competition that we have right now, it is very important that we expand our skill sets, and the master's degree kind of gives you that opportunity. At least the difference that I've seen during my graduation and when I started doing my master's, there were more opportunities on working as on research papers or engaging. I got an opportunity to basically engage to practical environment, which I kind of lagged while I was graduating. So, and you can explore, there's so many different courses now. I think back then there were so few, and it wasn't even clear which one, and your course selection always was based, oh, can I get a job after I take this course, or would I get a job? And I think that mindset always stays. But at the end, look through all the courses out there and see if this is something that interests you. And it definitely adds to your resume and also to your experience. So I would say, yeah, not a necessary, but definitely important.
Yeah, and just to add up to that, I completely agree with what Stephanie and Hrudaya just said. I also don't think it's a necessity. However, I do think that having had the chance to pursue my master's in innovation opened my eyes to digital healthcare. And during my master's, I had a lot of chances in which we had group projects, and we could actually choose which field we would want to cater our innovation or our presentation towards, and I catered mine towards healthcare. So I did a few projects on digital healthcare throughout my master's, and by doing those projects, I learned so much about the digital healthcare world. And also would say that I don't think it's a necessity. I think there's, as Hrudaya said, a lot of courses out there that would be very good to get started and start learning a little bit about digital healthcare. And also attending conferences. This is something that I found to be extremely insightful, because there is a lot of companies out there that you don't know that they have a foot into digital healthcare, and they have their own side. They're companies that they're not necessarily healthcare companies, but then they have a side that focuses on healthcare, and then they have digital healthcare technologies, tools. So I think any kind of exposure that you have to the field is always helpful. So it doesn't necessarily need to be a master's, but definitely some sort of either attending conferences or doing courses or certifications. That alone opens up your eyes and your vision to digital healthcare.
Great, thank you so much. So we have a few more. So this one again is for anyone. They're asking if you could offer some thoughts on opportunities or paths for someone who wants to transition into digital health from a clinical background and has an interest in improving clinical data capture, utilization, and access.
I can give some thoughts on it because I do have a real example. One of my friend, she completed her bachelor's in dental education from India, and after practicing for some time, she decided this is not something I want to do. I want to pursue. I want to go into digital health background, and I want to shift from the clinical side of the stuff. And honestly, there are a lot of opportunities out there, whether be it clinical data analytics, or you can go for health informatics. I think it's called HIM, information management. These programs often focus on managing and analyzing clinical data, electronic health records, and health information systems. I think that's one of a good opportunity, and there are courses out there that provide this. And of course, health informatics is another one that we often talk about. There are a lot of digital health startups as well that take on, that specializes in developing solutions for clinical data capture and stuff. So definitely there's opportunity out there. There are a lot of courses which can offer you to go towards that side. There are a lot of certifications as well. So yeah, it's never late. That's what I would say, because I am saying the friend I'm talking about, she completed her 5 years of dental education, then she did masters, and then she practiced for some time, and she decided, no, I think I had enough. I want to move to a management side of the stuff, and she pursued that. And coincidentally, she ended up being into the same company that I work with, not BHSA, but she's working for Vancouver Coastal Health. So, and that's how we met after quite a few years. And I'd say there's a lot of opportunities. We just have to go through the colleges and the courses that they offer, and there's so much out there that you can grab.
Great, thank you. Stephanie or Francesca, did you want to hop in on that?
Yeah, I can add to that. So I would say if you're currently working at, say, a hospital, you should probably look into if there is sort of an innovation department, or if there's sort of a department that already does sort of what you're hoping to transition into, because there probably is. And if so, you could see if you could connect with someone there. So that would be a suggestion if you want to connect with them on LinkedIn or do anything like that. And then also, I would suggest if you wanted to go back to do any education, there's master's degrees, which a lot of people, like I can just speak to the eHealth program, came from either nursing, or they came from, different backgrounds like technology, or from an undergrad in business. So there's lots of people coming from different backgrounds that are hoping to get into the space, and you can definitely do that.
Thanks. Any last thoughts, Francesca, on that one?
Just to add to what Stephanie and Hrudaya have already said, I think getting into the digital healthcare world, it's an excellent opportunity. Some resources for that, I agree, would be connecting with maybe your health information system, like your team within your hospital system, your innovation team as well. But also, I think we're slowly but surely moving very much into that digital healthcare world. So that is a great opportunity, and there will be so many options for you in the future. So I do encourage you, I think I am a little bit biased, but I do encourage you to look into that, because I think one way or another, at the end of the day, we will all end up working in at some capacity within digital healthcare if you're in if you're in the healthcare field. So I definitely recommend it. And yes, just like Stephanie said, reaching out to other departments within your healthcare system or within your hospital will always be helpful to have that first step in the door.
Great, thank you so much. All right, well, we're reaching the top of the hour now, so I'm just going to quickly wrap up. First of all, thank you to our 3 panelists. I'm just going to launch a quick poll, satisfaction poll. Please have a look and answer. Thank you so much for the 3 of you for giving us your thoughts. It was a really interesting discussion, and I really liked hearing about all your 3 various backgrounds. Very interesting, and obviously there's a lot of paths in this career, which I think even the 3 of you at as emerging professionals have shown that there's a lot of things. And I really like that you love our webinar Wednesdays, since that is my project. But let me just end this poll. I do want to actually tell you guys about our Digital Health Canada community. So we have all the Webinar Wednesday recordings available on the community. So if that is something that sparked your interest, definitely go check it out. We'll be launching a mentorship program soon. The applications for that have just closed, and that'll all be housed in the community. And also our webinar for next week is Patient Portal Soup, addressing equitable access for all. So that'll be very interesting, and that'll be on next Wednesday. And then also I heard this a lot in the presentations, talking about going to conferences such as our eHealth event, which is in May in Vancouver. So anyone who's interested in that, it is open for registration. All right. And that's it. Thanks again so much. And that's it for today. So bye, everyone.
Thank you.
Bye. Thank you.